Welcome to Serwa Tutorials. If this is your first time here, we offer bite-sized revision videos on various pathology topics affecting each of the organ systems. We hope you'll find our videos fun and informative. Hit that like button, comment, and don't forget to subscribe. Now let's get revising. Q fever. What is it? This is an infection caused by the proteobacteria bacillus Coxiella burnetti, which can lead to an acute or chronic disease. Etiology. Q fever occurs almost exclusively in populations who have frequent contact with farm animals. When the infected animal dies or gives birth, the infection is transmitted to humans by inhalation of aerosols. The Coxiella agent is very resistant and can persist in the tissue of the deceased animal, as well as in the soil of where an infected animal has died for extended periods of time. Symptoms. The inhalation of the pathogen causes the initial acute respiratory infection. Patients become febrile, experience headaches, chills, myalgia, anorexia, and acute pneumonitis with a non-productive dry cough. Patients also report of feeling general malaise, weakness, and weight loss. The acute infection may also affect the liver, presenting with hepatomegaly, and if it affects a pregnant woman, she may suffer a miscarriage. Most cases of acute Q fever are self-limiting and resolve without further sequelae. However, some cases progress into a chronic infection, manifesting as hepatitis, endocarditis, or osteomyelitis. The endocarditis tends to affect the aortic valve most commonly, which can lead to signs and symptoms of aortic stenosis. Where endocarditis has developed, additional symptoms of finger clubbing and a purpuric rash may manifest. Diagnosis. The best diagnostic test for identifying Q fever is immunofluorescence assay. This technique is used to identify antibodies against the Coxiella burnetti proteobacteria. However, a thorough history should be taken, as immunofluorescence assays are not used in routine clinical practice and are only used to diagnose Q fever to confirm an initial suspicion, where a patient discloses previous contact with infected farm animals. Serology tests may also be used for the same reason. A routine X-ray may show signs of consolidation and atelectasis during the acute infection, but this is only an indication of infection and is not diagnostic for Q fever or Coxiella infection. Sputum cultures, blood cultures, and biopsies are used to diagnose the chronic infection, but may not always be accurate, and false positives and negatives are common. Treatment. Acute Q fever infection is treated with doxycycline. This is a broad-spectrum tetracycline class antibiotic with known efficacy against Coxiella species. Where patients have chronic infection with signs of endocarditis, patients may have to be placed on long-term doxycycline treatment with the addition of hydroxychloroquine, an anti-rheumatic agent, as a prophylaxis and a preventative measure. However, as we all know, prevention is better than cure. In Australia, an effective vaccination program is in place and is recommended for all at-risk populations, particularly those with an occupational risk handling farm animals. I hope you enjoyed this bite-sized revision video on Q fever. Feel free to leave a comment, like and subscribe if you'd like to see more videos like these. Also, head over to my Quizlet link in the description for free revision flashcards. Happy revising!